Hello, Blood Talk fams. We talked about antimicrobial susceptibility tests using the disk diffusion method a while back. Today, we are going to be talking about another antimicrobial susceptibility test called an e-test. You will find that the disk diffusions and the e-test methods are similar in terms of principle and how they are set up. In today's videos, I will show you how the e-test is set up and the differences between the e-test and the disk diffusion method. Without further ado, let us get into the e-test. The e-test used a thin plastic strip that soaked in an antibiotic, which is similar to the disk diffusion method. If you want to know about the disk diffusion method in detail, I will make sure to leave a link to it in the description box below. However, the difference between the two tests is that each disk used in the disk diffusion method comes in a specific concentration. But the e-test strip comes with a gradient of antibiotic concentrations. The concentration is marked on the test strip itself. Procedures. First, make a 0.5 McFarlane solution of the bacteria of interest. Make sure that you select a few individual colonies to make the solution, not a big patch of bacteria. This is to make sure that you are well representative of the bacteria of interest. I explained how to make 0.5 McFarlanes in detail in the disk diffusion method, so please check that out if you need to review. Second, make a lawn of bacteria. Once you make the 0.5 McFarlane solutions of bacteria of interest, take a sterile cotton swab, dip into the solution, and strike the plates. Make sure you go back and forth, do not leave space between the strokes. When you finish, dip the swab in the solutions and turn the plate 45 degrees and continue streaking the entire plate. Repeat the step one more times when you finish. This means that you will streak the plates 3 times in total. Bring the plates and make sure that you have a nice lawn without any blank spots. Third, place the strip on the plate. Make sure that the entire strip makes contact with the plate. You can put more than one strip per plate. Just make sure you space them out so that when the elliptical forms, they won't overlap. Fourth, incubate the plate overnight. Fifth, read the minimum inhibition concentrations. You will read where the ellipse crosses the strip. The concentrations where the ellipse crosses the strip is the minimum inhibitory concentration. Benefit. Number 1. E-test not only tell you which antibiotic works, it tells you the concentrations of the antibiotic. Number 2. It is easy to use and set up. Number 3. Easy to interpret. Number 4. Can be used with a wide range of media and incubation conditions. For instance, the e-test can be incubated in a high CO2 or anaerobic condition. Now, the downside of this method is costly. The e-test is really costly compared to its counterpart in the disk diffusion method. That is it for today. What do you think about the e-test? Have you used this test before? What are the problems have you seen with this test method and how you solve them? An honorable mentions to a subscriber who requested this topic. Thank you all for watching and liking this video. I shall see you in the next episode of Blood Talks. And as always, remember, your blood tells you the story of your health. Bye!